and welcome to this edition of Spirit RX Podcast, Ancient Wisdom, Modern Healing. I'm Dr. Luke, quantum chiropractor, and this is Dr. Michael, naturopath extraordinaire. We love to integrate best practices of modern medicine with ancient remedies and modalities. In this podcast, we'll explore contemporary health and wellness topics with a blend of wisdom, humor, and practical tips for the everyday person. If you want to learn more about our stories, our businesses, how to connect with us, please click on the video link below.
Awesome. So last time we had a really interesting discussion on miracles. And how long has it been since we did that podcast? Do you remember?
Several weeks ago.
Yeah, it was a while ago. So we did a really great podcast on miracles, discussed what miracles were, reviewed some stories, and afterwards realized we had a lot more stories to tell
Right.
and felt like it was going to be more interesting for people to listen to more of those cool stories. So
Yeah, I
tell
would
the story.
encourage folks to listen to that part one. You could listen to part two first, it doesn't really matter, but there's a lot of really cool stuff in that part one video that we did. Why don't we just jump in? Why don't you share a story that has some miraculous elements in it that you experience in your practice?
So let's start with the first one. Years ago, I had a woman come into my practice and I was just starting out. When she came in, she looked like she was about, I don't know, maybe in her mid 60s, maybe late 60s,
Okay.
and looked like she just didn't look healthy. She looked really pale. Her skin just looked like she was just really sick.
Mm.
And so I'm meeting with her, I'm talking about what's going on, and she expressed how badly she's been feeling for a long time, and that her last physician that she had met with had diagnosed her with a fungal infection
Okay.
and put her on antifungal, which made her feel even worse. So she was really sick. And so I'm listening to her and I'm just looking at her, and she tells me this really complex history, just a lot of things going on. And the thought came to me that she just needs some nutrients. Maybe there's something going on with her gut. She had loose stool, and I thought maybe if I just give her some nutrients by IV, she might feel better. This thought had just occurred to me. So I had her come back. We set her up with basic Myers IV. So she got vitamin C, some B vitamins,
Okay.
and some like minerals that were in there. So not much in this protocol. Gets her first IV, and I only had her set up to do a couple of them. And she leaves and then comes back the next week and she looks a little bit better. Like she said, she had more energy, she was feeling better. So she got another IV the next week. And then I didn't see her again for a long time. And I think it went 2 months later.
Okay.
This woman walks in the door, completely different looking woman. Like she looked like she was in her 40s now.
Like her
And
young
I didn't,
sister.
yeah, like her younger sister. I didn't even recognize her at all. Like she was a
Okay.
completely different looking woman. And she comes back in, her face looks better. She doesn't have any wrinkles. Like it's just really different.
Wow.
And she just looks amazing. And I said, welcome back. That's crazy. You look really healthy. I said, what have you been doing in the meantime? She said, nothing. I just feel really good. And she came back to purchase, I think I'd given her a multivitamin or something that
Okay.
she could start with too. And so she purchased the multivitamin, had a little conversation, she left. And I got to thinking about it and I was like, I think I met a woman with scurvy. I
I
think that's what it
know.
was because I she checked all the boxes, and I thought, what are the chances of having a modern day scurvy in her? So to
Right.
me, why this was a miracle is that she'd gone through so much therapy and done so many other things,
Wow.
and all she needed was that little bit more invasive intervention, and she started healing. And once she could heal, she started absorbing nutrients. She didn't need IVs anymore,
Right.
and it literally de-aged her,
Night and day difference.
20 to
Yeah.
30 years. So that
I
was
love it that you really listened, you dialed in and listened to your intuition.
hmm
And I think that's really important because other doctors can follow the protocols, follow the rules, so to speak, but you might miss the key thing. So I love that. I love that. All right, let me tell you a story. So a woman called me up and lives several hours away and back just really killing her. And she tried all kinds of doctors and for several months was just in extreme pain and wanted to know if I could see her. And of course, I set up a time. She drove up to my office, and this is a woman, I'll say around 55 years old. And her back pain was so bad. She had to ride in the back of a truck. And then she literally crawled into my office on all fours, just in agony. Like it just like just seeing that would make your heart go out. So she comes in and she's with her partner and her daughter's maybe 20. Do a little bit of talking, but it's we got to get straight to the table. And just that whole thing about getting onto the table, it was an ordeal because it's such extreme pain. So anyway, she's on the table now, and I put my hands on her, and just putting my hands on her low back where she was saying it hurt the most. So I was immediately getting some information. And the first thing that popped in my head was this is about her mother. There's some issue about her mother, and there's this extreme pain. It was just, oh, I mean, I could just really feel it in my hand. Then I say to her, what I just said, I'm feeling this is a story about your mother, and there's this extreme pain. She starts to weep and weep. And so I'm not even doing anything to her other than just holding my hand there while she's tapping into my hand is bringing her awareness to that. So then she weeps and then she says, my mother, before she died, she had a broken back. And for several months, she was in the hospital bed and no one could move her. She was in extreme pain. It was just a horrible death for her.
Hmm.
And so I was like, wow, okay.
Wow.
So stay with this. So we go through the session, we get to the end, and again, she just wept most of the session. So about 30 minutes, but there was also all this heat coming off of her body. I made a few contacts to open up her nervous system to allow more of it to come out. But when she finally got up, she sat up on the table, which was just that in and of itself was pretty impressive that she could now sit up on her own. And what she told me was that, wow, something was going on related to her mother. And then her eyes got real wide. And she said, I've got to go talk to my partner. Now she can walk with assistance. So I'm holding her arm. And we get around to the waiting area. And she walks up to her partner and she says, are you getting ready to leave me? And he says, no, I'm not planning to leave you at all. I love you. I'm not going to leave you. And now she cries even more. And so, what had happened, what she realized was that there was this pattern that she witnessed with her own mother towards the end of her life, trying to hold on to others, trying to hold on to life itself. And so she had this deep fear that her partner was going to leave her, and so she just dropped into this old pattern that she subconsciously had picked up. So, anyway, like you talk about a transformation because now she's basically with just assistance, she's walking out of the office. Okay, that's pretty cool, right? So, I had another appointment scheduled with her for the next day. So, she comes in the next day with a cane. And she's, oh man, I'm just, it still hurts, but I am doing so much better. And then she says to me, let's do another session. And can my daughter do a session with me at the same time? Oh, sure, let's do that. So the mother's on the table. We get started. I asked, what's the daughter's big problem? And what I was told was that she had no period, no menstruation for like over 2 years.
Oh, wow.
And that's pretty extreme for a young woman. And so when I got over to work on the daughter, same thing. I put my hands on her low back, and same thing. I said, "Your mother, you are following a pattern of your mother." And now she started to tear up a little bit, and she says, "Yeah, I guess I've been so worried about my mother that I'm just like holding on for dear life." We do a session, we finish it up, and really positive, powerful. Now the mother gets up and walks with no assistance out of the building and they leave. And so now they're ready to drive back 2 hours to where they live. And the next day she calls me and she says, you're not going to believe it. And within a few hours, my daughter started her period.
Wow.
What a transformation in just a couple sessions. And so there's a lot of layers to this, but I think that we can have this subconscious patterning that we don't even realize. We see, especially a family member, the way that they deal with the trauma, and then without even thinking of it, we might fall into that same pattern. So all the doctors, they couldn't figure out what was wrong. They weren't finding the mechanical, physical thing that was the problem. Really, it was this emotional, deeply subconscious pattern. But amazing transformation. She was so in such pain. She was telling me at the beginning, "Oh, if I need to, I'll move up here to the area. I'll rent an apartment. I'll move up here if I need to get treatment." But then after 2 days, I never have seen her again. And that often happens too with the miracle, in my
Yes.
experience, is that they don't need you anymore. It's like their life changed and they're ready to get on with it. So then they move on down the road. And but for me, I still savor that moment because it was such a life transforming experience for the whole family.
Mhm.
And yeah, just the interaction between the three of them, it was just so powerful.
That's something lost nowadays. I feel like I don't know what it is, but it's something about the medical system and how we work with patients now. It seems like the goal is not necessarily to have them get better and not come back for a lot of different
Yeah.
practices. I'm not saying that's,
Well, like I mentioned earlier, I think that there's protocols for all of our disciplines. And so we start at the top of the diagnostic tree and work our way down. And sometimes we're not asking always the right questions
Mhm.
to get to what the causes and roots might be. And we're also not maybe as doctors taking as much time as we should to open up our intuition so that we can be led to that right question to get to the root.
Yeah, and I would say that across the board, one of my normal goals with a patient is to have them not have to come back. That's when I
Right.
know I've done my job.
Right.
They're feeling good enough. They're out there living their best lives. They don't need to be in my
Right.
office talking to me.
And I have to admit, after that was over, about a week later, I was feeling a little bit depressed. And when I was like, why am I feeling that way about their situation? And it's
Mm.
because they don't need me anymore. They don't want to come back. Then that means there was an exceptional thing that happened and I need to celebrate that. But the feeling is, oh, you should come see me. That's the ego gets in the way.
Yeah.
And yeah, I've just learned that over the years, when something happens very rapidly, very miraculous, that's it. And that's all they need to come. And that's enough.
So I'll tell another one.
Yeah. Tell me your
Someone
story.
else who came in and then never came back again.
Okay.
Very similar situation. This patient, he was I think, late 50s gentleman. He worked in the chemical industry. And I don't know exactly what he did, but he said he had to suit up a lot and move chemicals around. And he comes in and he's got this autoimmune disease, unknown what the cause of it is. It's a dermatological condition called Grover's disease.
Okay.
And he had gone and seen a dermatologist. The dermatologist had done a skin biopsy and shown this is definitely Grover's disease. Now, this
Okay.
is supposedly an incurable disease.
Right.
Like, you just live with it, you deal with it, at least at the time. This was a while ago.
Right.
And so basically, he was told he was going to need to go on a steroid and a steroid cream, which he did, and it helped, and then it came back worse.
Mhm.
And so he comes in, he's just frustrated with the situation. And I said, let's talk about what you're doing all day and how we can help you heal. And discussed with him the type of food that he's eating, discussed with him, his bowel movements. That's a really important
It
thing as a
is.
doctor and as a patient. You want to know, how are those bowel movements
What's coming
functioning?
in and what's coming out.
Exactly. Are they flowing a little too fast, maybe a
Right.
little too slow?
Right.
So there's a lot of questions around that. And long story short is I discovered through deeper investigation in his case that he had a really strong toxic overload likely, and that he was definitely not absorbing nutrients.
Mm.
So just based on stuff he would see, and there were some other things that kind of went into that. So I just said, let me tell you what I know about this disease,
Okay.
and then let me tell you, I know it's possible to heal.
Yeah.
And so you have to believe that you can heal. So we had a conversation around that, and I had him do some sauna therapy, some different kind of detox things. And then I had him do some IVs, specifically that same kind of IV, like vitamin
Right.
C and some
Right.
other things there. And then I actually think he did ozone too, which was an
Okay.
interesting addition in his case.
Okay.
And he came back and he said, "Hey, the rash is clearing up. It's going away entirely." And I said, "That's fantastic. Now the real goal is to see after you're done with these IVs if
Right.
it stays gone." So I didn't see him again for a long time.
Right.
Eventually he came back in, same kind of thing. He came back in to purchase some supplements that I had on his protocol that he could only get there at this practice I was working at. And he came and purchased them and he was like, "Yeah, the rash is gone, it hasn't come back. I haven't had any issues. I just figured I'd come get my supplements and stay on them." And the supplements were just nutrient replacement. That's really all I was doing. I wasn't doing much in his case. But I think at the core of it is when we are exposed to things, even with suits on over a period of time, that can
Right.
accumulate. And somehow it was affecting his gut in a way where it affected his immune function in such a way that it
Right.
created this rash type dermatological condition. And for him, and I don't know if this is across the board how it would work for every patient with Grover's disease, but for him, it went away and never came back. And that was a cool miracle. So,
I like what you said because when you said you believe it can be cured, and you suggested that he needed to believe that, I would speculate that everything is reversible. Now, if something is quote unquote incurable, the likelihood of it is small,
mhm.
but there's a chance. And so let's lean into that. That's where the real miracle happens. So I love it that you set that path out for him and then he stepped right into it and you found the solution. That's awesome.
And admittingly, I didn't know enough about this kind of rare dermatological condition to know that he couldn't heal from it. Apparently, that was the case. As I researched it later, I
Right.
discovered this, but I
Okay.
had that conversation.
Sometimes a little
So,
ignorance is a good thing. I remember as a youngster hearing a story from scripture about Jesus healing the 10 lepers, and they all get healed, and nine of them take off, enjoy running away, and then one comes back to say thank you. And then the whole time I'm thinking, like, why are they lacking gratitude? They should be at their feet, at his feet, thanking him profusely. And I guess just because I've been in a small way associated with a few things that have happened dramatically, it's people, it just, everything changes. And so they're ready to move forward to something else. So they have gratitude. They have gratitude to whatever the divine healing, and but they move on very rapidly.
yeah.
So they do have the gratitude. It just isn't always the way we might, from the outside looking in, expect it to show up.
And that's a huge compliment, too. The reality is that the biggest compliment a patient can give you is to be able to live their best life without you.
Exactly.
So, in a lot of ways.
Exactly.
Let's hear your next story. I'm excited to
Okay.
hear it.
I'm going to tell you just a short one, a little short one. A few years ago, I had a woman, she probably was, let's say, 65. And she came to see me, and her major complaint was that her tailbone hurt. She had a lot of pain around her tailbone. And she cited an old injury, a falling injury from her youth, and then also some difficulty from a pregnancy. And it was like, okay, but during the last 10 years, no matter what she would do, just nothing would change it. Again, here's one of those one session, one and done, and then never see him again situations. We got on the table and I made one contact on her. Breath changed, her awareness changed. And the way she described it was like at the base of her spine, her root chakra just opened up, and it just all the energy started moving. In her mind, there was this physical history was the problem, but in reality, the energy center there, the chakra, or we might, in more medical terms, we might talk about there's nerve bundles
Mhm.
that line up with the chakras. But so that when that got turned on, it's like turning all the lights on in the whole place. And then now all the energy started flowing, and just she didn't need to come back anymore. She was completely pain free when she had been in chronic pain for 10 years.
It's awesome.
Yeah, so cool when that happens.
Yeah, to deal with something for 10 years and in a short session, have it go away. Yeah, that's a miracle.
Yeah, one little touch, just
Yeah.
one little touch in the right spot, and poof,
I
everything
think you
shifted.
mentioned that last time in the last one, just as a side note here, that miracles can oftentimes be a change in time, something that happens really rapidly that would
Right.
typically take a long time to do. That's cool. I love that.
Yep.
So, my next story is actually about a cancer patient that I met with, and I'm going to share a picture of her now. So,
Okay.
that's going to pop up here when
Okay.
we do the editing later. And this is her when she was pretty much at her worst, which was over Thanksgiving. It was a very sad situation.
Okay.
So, she had breast cancer that had metastasized
Mm.
into her liver, to her lungs, and bone. And
So normally, if someone's in that situation, what would we be thinking?
you would think there's not much you can
Yeah,
do.
we're at the end
Yeah,
stages there.
yeah.
Yeah.
And some
Yeah.
people, they can be in that stage for a very long time. And so when she came to see me originally, this was long before this picture that I just showed.
Okay.
She was in a bad state, but not quite this bad.
All right.
And we did a lot of work for her. We did just a tremendous amount of therapy. And ultimately, we were able to get her very close to a point where her cancer antigens were on almost non-detectable. We got her pretty low. And she was that way for quite some time. I had stepped away, hadn't conversed with her for a while, and then she came back on board with me, and we were starting to see an increase in her cancer antigens again, which is why she came to seek me out.
Gotcha.
And so there were just some different things that were done in the background that we suspect may have made things start to get worse. It was interesting because at that time I said, I'm just going to do natural therapies. We're not going to push for any sort of chemotherapeutic or any sort of
Okay.
smart drug or anything
Right.
at this
Right.
point in time.
Yeah.
I
Quality of
did
life is a big issue.
exactly. And I did really want her to have a drug on board right away. There was a particular smart drug that's used. It's called a PARP inhibitor. And
Okay.
typically that is reserved for patients who have like a BRCA mutation, which is a type of mutation that's
Right.
hereditary and passed
Right.
down, which she had.
Genetic.
And so I really wanted her to get that. We were having a lot of trouble getting that approved by insurance. And it wasn't really me, it was another company that was doing it
Okay.
for her.
Okay.
And we were just unable to get it for a long period of time. So we were doing a lot of therapies for her, but it did seem like things were progressing very slowly. She went and did a very invasive procedure. And that procedure was aimed at trying to help those liver lesions.
Okay.
And I think that the stimulation of inflammation in the liver from that procedure really just fed this cancer.
Ah.
And
Right.
so it just rapidly progressed. And that's where she ended up in the state of the picture that I'm showing
Okay.
right now.
Gotcha. Gotcha.
And so at that point in time, I had never, in the entire time that I've been working with patients, had a patient get to that point where they were
Okay.
jaundiced, their liver was in failure,
Ah.
and that they were able to come out of that and
Right.
survive. Like every
Wow.
other patient, usually the doctors, whoever I refer her to start doing emergent care, would give up. They'd just be like, yeah, you need to prepare yourself, get ready to
Cellular
pass
state.
an
Yeah.
assault. And they basically did the same thing to her, but she's a fighter and she
Okay.
talked them
Okay.
into getting a chemotherapeutic on board.
Okay.
And what was interesting, this is how it happened. So at the time, so when you have breast cancer, there's typically you're either going to be estrogen receptor positive. This is the general kind of like
Okay.
guidelines of
Okay.
division that happens. It's actually much more complex. But you're either going to be estrogen receptor positive, progesterone receptor positive, HER2 positive, or you can be negative on any of those, right?
Okay. Okay.
And there's different like levels of receptors and percentages and things that kind of go with that. And you could be triple negative, is what they call it when you don't have all three of those.
Okay.
Generally speaking, she had gone on a PARP inhibitor. When she did it, she was not able to tolerate it, and it made her way worse. And so I had done testing in the past for her. And in this testing, we looked to see what type of cancer she has and if it
Right.
has mutated.
Right.
And we got this one test back one time where she was HER2 positive. But every other test that we'd ever tested, she was only ER/PR positive and HER2
Okay.
negative.
Okay.
This conversation happened. We said, you know what? Just because you had this positive HER2 one, there's a possibility that you might be able to go on another med and it could help.
Okay.
Her oncologist that she was working with back home in this like very advanced state agreed. said, okay, we had this one, we can do this. I'm going to put you on Enhertu was the
Okay.
name of it. And
Okay.
that's a combination chemotherapy with the HER2
Okay.
drug. Long story short is she responded very well to this. I had taken her off of everything. She started to see some diminishment in disease, started to feel a little bit better. And then I started bringing back in the natural therapies a little
Okay.
bit at a time. We're
Okay.
focusing on just little bits at a time, what her liver could handle. She had started to swell really bad, which
Mm.
happens with liver failure. And so she had to go in, and this was probably the worst part of it, and had to go in and keep getting drained.
Ah,
And I was like, listen, we're going to get through this. And what I want to focus on here, though,
okay.
is not necessarily the amazing thing about her recovering
Okay.
when others have passed at
Right.
this point. I think I want to focus more on just the fact that she had a lot of people praying for her.
I see.
Like her
Right.
mom was praying for her parents were praying for her whole family. Like I was seriously on my knees praying quite a bit.
Okay.
And, whatever your belief is, we were all wanting to see her get better,
I see.
including her and her family and all her friends. And like I've, had other people praying. We were all putting that vision in our mind. And she had a miraculous response in a place where that should never have happened. Like it
Right.
just simply doesn't happen very often.
Right.
And so this is her now. So here's a picture of her now. I'm going to
Okay.
put it up there.
Wow.
And this was a year later.
Okay.
And so you can see the
Yeah.
difference.
Amazing. We're
You
laughing.
can't see it right
We're
now.
laughing because
Yeah.
the picture isn't here
So,
yet, so I'm pretending like I see this amazing picture.
but
Amazing.
she's an incredible person. She's still dealing with this disease, but I really believe she's going to keep getting better. And what I look at as a whole from this is, can we have more time with the people we love? And can we
Right.
have our best quality of life for as long as possible? And that's really the goal. The fight against cancer oftentimes is a fight against ourselves. And what
Mm.
we really need is to recognize that we don't need to fight. We just need to get along. And we need to get along in a way to where those cells start acting like
Right.
they're supposed to.
Right.
So the rebellious little turds that they can be.
Yeah. I love your story because there's all these elements that come together. So there's your belief and your persistence in finding the right treatment for her using the tools at your disposal. She has a strong will to survive and a
Mhm.
lot of people in her corner pulling for her. And then that faith in the higher power, a community of people, and then mixing all that together. And then that creates that miraculous outcome. I think that's amazing. That's a tremendous story. What a blessing.
Yeah. And she gave me permission to share
Oh
this
yeah.
these
Yeah.
pictures.
Cool. Cool. All right. I'm going to tell you the next story is like different. I'll give you a little context first. When I do the introduction and I say that I'm a quantum chiropractor, quantum is a word that people throw around all the time. What does that really mean? But I'll say it this way, that if someone makes the suggestion that there are multiple lives that are happening or multiple possibilities, yes, because that's quantum, right? And so this is going to be a story where I'm operating more in that quantum realm and to get to the shift with the person. So let's jump in. A man comes to see me. He is from Southern California and he is driving up to visit family where we live in Southern Oregon, and it's about a two days of pretty grueling driving. And normally he flies. This particular time, he decided to drive, and after 2 days in the car, his low back was just like seized up,
Mm.
like he could just barely walk in. And again, I always am looking first at what are the physical things that are going on. And obviously being in a flex position for a long time. Now, he told me that visiting family was always a very positive thing for him, not negative. So there wasn't this dreadful, if we were like in a flex position with dread, that can definitely do a number on us. But anyway, he was like happy to come up and see his family. When he got there the first day, he couldn't even get out of bed. He's on his vacation to see his family. Day one, he's just staying in bed. So someone in the family sent him over to see me. So he comes in, and like I said, it was difficult for him just to get up on the table. Anyway, we get going, and as soon as I'm opening up his nervous system, then I'm starting to ask the question. And so the question that I asked with him is, and I'm doing this in my mind, not out loud. So I'm asking, is there a time in your life or in another version of you where there was something traumatic that happened to you that has some similarity to what's happening to you now? And if there is, let me see that. What I began to see was an element from a story from his lifetime. So I was seeing a small boy about 10 years old, and he's in a Catholic church in Mexico. And he's on the side, and we're seeing his family's kneeling down praying with a priest. And I don't know why they're all in this church setting,
Hmm.
but okay, you know uh, here we are. So then now I'm like, I'm going to enter myself into this story. And what do I need to tell him? I'm just going to tell the little boy something. So I'm asking, like, what is the message that he needs, and so that I can just be the messenger of that. So that when I say give a message, to me, that's the very definition of what an angel is. It's a role, right?
Hmm.
This messenger role. I'm like, okay, this is a church setting story, so this is like an angelic kind of thing. So anyway, as I'm like about to do this, it's no, I just need to, as the messenger, look like a young priest, and he needs a message of peace. I'm like, okay. So I enter, as I'm in the story, I say to him what's going on, and he just says, oh, there's my family over there. They're praying. Okay. He said, they're praying for me. And I'm like, oh, all right. And I said, God wants you to know that he loves you and that he's giving you a gift.
Hmm.
That's all you need to know. God loves you and he's giving you a gift. And the boy just said, okay. Meanwhile, in the present current reality, the man on the table is having these deep sighs and making all kinds of noises as this other story is unfolding. And it goes along, and he's just releasing so much emotional energy, heat energy, all kinds of things. When the session was over, he sat up, and of course, he looked like, whoa, like he'd been somewhere else. And I always ask the question first, what did you experience? What you're aware of? And he said a couple of things. And then I asked him this question. I said, have you ever in your life had an experience with an angel? And he says, no, but yes, but no. And I said, can you explain that to me, please? And he said, when I was a young boy, 10 years old, I had a certain kind of cancer. And my family took me all over the place to every kind of doctor you can think of. And they all said it's incurable, nothing we can do. So then my mother said, there's this certain Catholic church we need to go see down in Mexico, and that has healings. Let's go there. And so he said, we went there, and I was in this church. And when I was in this church, I saw my family praying. He said, I just felt this angelic presence, but I didn't see an angel with wings. There was just a person there, and it just felt very angelic, but nothing like dramatic like you might see in a movie. And I was like, oh, that's really interesting. So and then I said, then what happened? And he said, I went back to see my doctor 2 weeks later, and the doctor said, I can't believe it, you're cured. And then my mother was like, I told you we need to go see the priest at that church. Praise God. You know? So I was like, whoa, okay, this is amazing. So anyway, then now I proceed to tell the man what had transpired on my end of it, this story about me entering into that quantum realm and giving him that message. Now, like tears are starting to come down his face. And I say, now hold on. I said, let me dial in right now. I'm getting some information from Spirit for you for right now as a follow up to this. And then I said, okay, here's what it is. I said, do you remember that movie, Saving Private Ryan, where Tom Hanks is in there and his squadron sent to go find Private Ryan. He's the last one of these brothers that's alive. And the president's like, we got to save that guy. Let's go send a rescue mission and get him out of there. All of those men that came to get him out ended up dying in the movie. So I said, do you remember that scene at the end of the movie where Private Ryan is now an old man and he's visiting where they were in Europe and he's at the cemetery and he's by himself and he's getting very emotional at the grave of these men. And I usually get a little emotional too as I tell the story. But at the end of that, he sees his wife and he says, was I a good man? Did I live a good life? And then I said, do you remember that part? So this person that's come to see me, he says, yeah, I remember that part in the movie really well. And I said, now listen to me. God is telling me to tell you that you've received a gift, the gift of healing, and it's free. And you're not just expected to do anything about it. I said, do you ever have these times when you mess up in your life and then you feel guilty? Oh, I'm letting down God. I'm letting down whoever, that I'm not doing this. I'm not being better. And he said, yes, I have that all the time. He said, I'm actually having that right now. A relationship went sour. And I said, you don't have to do anything. All that God wants from you is to just have that love, that acceptance, that gratitude, and then just love your life and do the best you can. You don't have to be Moses. You just have to be you. Just do your job, love every moment, savor it, and just be a blessing to others. He really wept, and his back pain was gone.
Oh, wow.
And he walked out of the door a different person. And again, never saw him again. That's a theme with all of this. But I'm not saying that there has to be this Christian element of God that is dialed into. But in this particular story, for this man and for his faith background, that was the expression of the divine that showed up for him.
Mm-hmm.
And it's very valid, and it just changed him completely. So it was that moment when the sacred comes in and when his life has changed. So like that story is going to always stick with me. And that's an example of when I say that there's a quantum element. That's maybe not something that a regular chiropractor is going to be a part of.
Yeah, that's true. Well, I would say that my impression from that is a very different form of seeing the world than a lot of people see it. I think a lot of people look at the world from a very physical perspective.
Right.
And they don't always see that the physical is just a minor aspect of reality, like of what we can understand and see through our five senses. And there's just so much more. And I think that, that your miracle story is a perfect example of how we can tap into that as individuals and see miracles in our own lives.
And when we change the aspect of one of those stories, we're changing all of the stories. We can wrap up here, and some of these other stories are gonna pop up. And if you, as a listener or viewer, if any of this is resonating with you and you want to hear more, just leave us some comments. Give us a shout out. I know for me, I can talk about this kind of stuff all day long. I love it.
Yeah.
And yeah, it's just amazing to be the instrument in some of these major life changes that people experience.
Yeah, and I'd really like to make this kind of a theme of ours that we do over time. Just go into some of the miracle stories again.
Yeah.
In the future. So
yeah, maybe we call it the miracle whip. We whip back and forth with these cool stories.
Thank you guys so much for joining us. It's always a pleasure being able to do these podcasts. And as you can see, we're in a different space now. And yeah, give us feedback, communicate with us. We want to learn what you guys are looking for, and that'll help guide our future podcast decisions.
Awesome.
So
thank you, everyone.
Awesome. Take care.